You're watching Coronavirus in Connecticut. Doctors answer your questions. Sponsored by Hartford Healthcare.
Welcome back to Coronavirus in Connecticut. Doctors answering your questions. The mental health of many people in our state and the world has suffered because of the COVID-19 pandemic. And a study out now shows that it could lead to an additional 75,000 deaths from alcohol and drug misuse, as well as suicide. Joining me now to talk more about this is Dr. J. Craig Allen, the medical director of Rushford. Thank you for being with us. That's a huge number. Are you worried about mental health for the long term, even as isolation eases when we reopen?
Well, I'm worried about everybody's mental health. I think this has been tough on all of us. And it's just a continuum. People that may have had pre-existing problems might be suffering more. But I think all of us need to be taking care of ourselves and being mindful of our mental state. I'm concerned about that second wave. I'm concerned about people who are now going to be realizing that they're struggling and having a difficult time, and they're going to want to come in for care.
And people are so worried about money. How do you deal with that fear?
Fear of not having enough money. Well, we happen to live in the state of Connecticut, which does a really great job of getting people coverage for mental health disabilities and substance use disorders. So if you were to access, for instance, our call line that we've just established today, that's one of the things that we can help you with and get you connected to one of our programs. And within our programs, we can help you find out what sort of supports and resources there are in the community, both the state resources and federal.
So important that people know that there is support out there, and I want you to talk more about that. This 24-hour hotline just launched today. It offers free mental health services. Anyone can call this?
Anyone can call, and I really urge people to take advantage of this. You don't have to say, boy, do I need to be hospitalized? Am I going to do something terrible? If you have a concern, if you have a worry about your child, about your teenager who wasn't able to go to graduation, even if it's a small thing, call and talk to a mental health professional, and they'll help to steer you in the right direction. And if it's something more serious, then this is an opportunity to get engaged in top-notch, high-quality treatment that we provide.
And we have that number for you. It'll be on the Channel 3 app and WFSB.com. A viewer wrote to me worried that all the masks and social distancing could cause young children to suffer from fear for a long time, that they're afraid to go outside. What do you say to that?
Well, I think it's really important to gauge where your kids are at, how they're doing. You know, first you take care of yourself, right? First you put the oxygen mask on and manage your own anxiety. But for kids, you want to check in with them, and you want to talk to them on their own developmental level. So ask them what they know. Try to find out where they're getting their information, and if it's not good information, limit it, and ask them if they have any questions for you. It's really important to help them understand what they can do to keep themselves and others safe. It empowers them. You know, practice things like washing hands.
Doctor, I'm so sorry we're out of...
Talk to them about the importance.
I'm so sorry we're out of time, but we know we want everyone to stay safe and stay healthy out there, and thank you for joining.